Welcome doctors. If you've ever prescribed Zepbound, or are about to, you already know, it's not a medication you just send to the pharmacy and forget about. It's a high-cost, high-impact GLP-1 therapy. And nearly every insurance plan? They want prior authorization. Today, we're walking through the complete Zepbound PA process, step by step, using a real-world example from Staffingly's virtual medical assistant playbook. So, whether your patient has obesity, type 2 diabetes, or newly FDA-approved obstructive sleep apnea, let's start with the basics. What is prior authorization? It's how insurance companies decide if they're going to pay for a medication. They want proof that the treatment is medically necessary and that the patient meets their criteria. And for Zepbound, they're not lenient. They want diagnosis codes. BMI, failed past treatments. Evidence of weight loss attempts. Even sleep studies if we're talking OSA. So when does the clock start? The moment your provider writes that prescription, your back-end team should start the PA. Here's what the process actually looks like for, say, patient Y. Step 1. Confirm the diagnosis. Does it match one of the approved uses? Obesity with BMI is greater than or equal to 30. With comorbidities like hypertension or diabetes. Whatever it is, make sure the diagnosis is updated, coded correctly, and backed by the chart. Step 2. Gather patient weight and history. You need height, weight, BMI, and records of previous attempts to lose weight. Document any past medications for obesity or diabetes. If they have OSA, include sleep study results and CPAP notes. Step 3. Check coverage. Log into CoverMyMeds or the insurers portal. Is Zepbound even on their formulary? Do they have a specific PA form? If it's excluded, don't waste time. Look for alternatives. If it's covered, move forward with confidence. Step 4. Log into your portal. CoverMyMeds, the insurance provider site, or EMR modules like Athena or ECW. Start a new PA request for tirzepatide and select the correct diagnosis, obesity, T2 German marks, or OSA. Now, Step 5. Fill out the PA form. This is where accuracy counts. They'll ask for ICD-10 diagnosis, BMI and comorbidities, medications previously tried, documentation of weight loss or glycemic control, recent labs, provider credentials. Then comes Step 6. Submit and track. If you're using CoverMyMeds, it routes instantly. If you're using an insurer's portal, keep the confirmation number. Save the PA ID. Most decisions come in 3 to 5 business days, but don't assume. Follow up if there's radio silence after that. And finally, Step 7. Respond to the outcome. If it's approved, great. Note the auth number in the EMR. Tell the provider and pharmacy. Let the patient know the medication is ready. But if it's denied? That's where your appeal game begins. Denials aren't the end, they're a signal to regroup. Start by reading the reason for the rejection. Was the BMI too low? Did you forget to document prior medications? Did they misinterpret the diagnosis? Gather the missing data. Clarify the provider's intent. Write a clean, strong letter of medical necessity. If needed, schedule a peer-to-peer review. And make sure you track the appeal deadline, most are 30 days. We've seen this work. Fast, accurate appeals often reverse denials within a week. Now, let's talk about why this really matters. Zepbound can be life-changing, but only if patients can access it. A well-run PA process means faster starts, fewer denials, less stress for providers, and most importantly, better care for the patient. At Staffingly, this is what we help teams do every day. And with high-cost drugs like Zepbound, a missed step can mean weeks of delay. What's the big takeaway here? Submitting a PA isn't just form filling, it's a strategic, clinical, and administrative task. But when done right, it works. So next time Zepbound is prescribed, you know the playbook. And if you're part of the Staffingly team, you already know, we don't leave these things to chance. Thanks for watching, doctors. See you in the next one.